Danika Watson, nurse practitioner. Today's topic is going to be over why our nurses, in particular my nurse, does some of the testing she does before the provider comes in. Disclaimer, this is not medical advice, recommendations, or a diagnosis. This does not take the place of a well child check or a sick visit. If you have any questions, please see your healthcare provider. So I'm not speaking for all healthcare providers or all facilities, but particularly Nevero Pediatrics, the facility that I work for, and more specific, my nurse, a lot of the times does testing prior to myself or our physicians going into the room. Sometimes this is not well received by parents, and I kind of want to give you some background on why this takes place. Our nurses are highly trained and they know what words to listen for on your symptoms, what assessment to do prior to us getting in there. They may not take their stethoscope out and listen to your baby, but they can tell by their breathing, they can tell with the symptoms you give us and the history what might be going on. And we've trained our nurses very well to pick up on these things. So testing can be done prior to the physician coming in. Where this is beneficial is when you are, a sick visit in between multiple sick or multiple well checks, particularly in our facility, and the testing sometimes takes 15 minutes to run. So we are trying to be super cognizant of your time and have those tests pre-running before I go in and make almost the same assessment or the same, come to the same conclusion that my nurse does, that your child needs a certain test. This is not to rack up a big bill for you. This is not to probe your child more than needs to. They really know what they're listening for or what they're looking for, and they try their best to make sure that we stay on time in our appointments. So one of the ways we do that is by pre-testing before the physician comes in. What you don't know is when they walk out of the door and they close the door, they usually find the physician that they work for or the practitioner that they work for, and they ask, do you want me to do X, Y, or Z? This is what's going on. Would you like me to proceed with blank? And 9 times out of 10, the answer is yes. Every now and then I'm like, I'll go in and see first to make sure, or I don't know if that's the best thing right now based off what's going on and what I've seen today. I'll go in first. So it's not just them. It's a decision that we make together. If I'm not in the hall, sometimes they wait even. So if they say, I'll be back to do a swab, and then they don't ever come back, well, it could be that they're waiting on me to come out of a room, or they've talked to me and I said no. So I just wanted to give you a little bit of information to let you know that our staff are highly trained. They're highly qualified. They know what they're doing. And there's a rhyme behind the reason of them wanting to swab your kid before you see the provider. I hope this clarifies some things. I hope you are understanding when they ask to do those things. And you all have a blessed day.